In part 3 of osteology, I have covered about the bones of the lower limb, that includes the pelvic girdle, then the thigh bones, leg bones, and the foot bones also. So I have also shown all the muscles that is related to these bones, that origin and the insertion part, and also the nerves that is in contact with the bones. So hope you will enjoy the session. Let's start with the session now. Coming to the bones of the lower limb, we have to start with the pelvis. Okay, then we will be discussing about the femur, then tibia, then tarsal bones, then the metatarsal bones, and the phalanges. Okay, so now if you look at the hip bones, okay, you know what we call that as pelvic girdle. Okay, so you have the right hip bone as well as the left hip bone. So what you see here is the actual pelvis. Okay, so this is the right hip bone and this one is the left hip bone, the right hip bone and the left hip bone. So what you do is, let's go ahead with the pelvis actually. Okay, now the pelvis consists of the sacrum. The sacrum, it actually belongs to the vertebral column, and the coccyx, that is also belonging to the vertebral column. See here, this sacrum and this coccyx bone, both are belonging to the vertebral column, whereas this part is the right innominate bone and this part is the left innominate bone. Actually the lower limb bone starts from this bone, okay, from the ilium. So what we will do, we will see the pelvis as a whole, okay, for a better understanding. So there are huge differences between male pelvis and the female pelvis. Female pelvis, naturally, it has to accommodate child, so during the time of pregnancy. So if you look at the bony arrangements, the female pelvis is broad, okay, whereas male pelvis, it's some sort of a funnel shaped. Okay, but the parts names all are same. Okay, there are few differences, like coccyx will be everted for females, it will be inverted for male. This ischial spine will be inverted for male, it will be projecting outwards for female, and this diameter will be more in females. Like I can show you the female pelvic model. Okay, see, this is a female pelvis. You can see a broad pelvic room, whereas in male pelvis you cannot see such a broad pelvic room. Okay, so this is the difference between the male and the female. There are many differences that we will see separately. So now if you look at the bones of this pelvic regions, okay, as I told you, this is the right hip bone, that's the right innominate bone, this is the left innominate bone, and the sacrum and this coccyx. Okay, these are the bones that is forming the pelvis actually. Pelvic is a cavity like structure which is having vital organs like reproductive organs, digestive organs, then urinary organs like bladder, uterus, then vaginal cavity, rectum. Okay, so now if you see the pelvis as a whole, as I told you, this line, so let me draw it for you. This line is the iliopectineal line, and this prominence is called as the sacral promontory, and this is the sacroiliac joint, the strongest joint in the body. Sacrum and the ilium is joining here. Okay, this is the sacroiliac joint. Okay, and this line, what you see is the pelvic inlet, whereas if you look at the pelvis underneath, you can see the pelvic outlet. This area is called as the pelvic outlet, the point between this four. This is the os pubis joint, this is the ischial tuberosity, and this is the tip of the coccyx. Okay, So you can draw imaginary lines. And this is the pelvic outlet. This area is the pelvic outlet. Okay, so if you look here, if you look at the muscles around here, okay, so what you do, you draw one imaginary line between this two ischial tuberosity. So what you see is you get two triangles. Okay, this triangle is a urogenital triangle, and this triangle is the anal triangle. And this is the urogenital triangle. Okay, so this is what you have to understand in the pelvic outlet. Okay, where there is, for females, this is anal opening, and this is a vaginal orifice, and this is a urethral opening. So the urethral opening and the vaginal opening is present in urogenital triangle. The anal opening is present in the anal triangle. Okay, so this is what we call it as a pelvic outlet. And what you see here is these muscular structures of pelvic diaphragm. If you see from above, you can see these are the pelvic diaphragm muscles. Which is supporting the pelvic organs. So let's not deviate the topic. We will go to the osteology part. Okay, now I will separate these bones, and I am going to explain one innominate bone. Okay, so for that I will remove the other bones. Okay, this is the anatomical position. Innominate means the word is irregular. You cannot define any proper shape. So this is the anterior view, and this is the posterior view of the right innominate bone. Okay, so in one innominate bone there are three bones, that is the ilium, the ischium, and the pubis. These are the three bones. Okay, these three bones unites together to form a cavity called acetabulum. If you look at the lateral aspect, this area is the acetabulum. The socket of the hip joint. We call it as the socket of the hip joint. So what to do is, for your better understanding, just draw one imaginary letter Y. Okay, when you draw one imaginary letter Y, this divides the bone into three parts. Okay, that is the ilium, the ischium, and the pubis part. Okay, these are the three parts of these bones: the ilium part, and the ischium part, and the pubis part. These three bones are separate bones in the intrauterine life, but it gets fused as the growth takes place. Okay, so these three bones unite together to form a cavity that is called as acetabular cavity, where the head of the femur comes and fits here. Okay, so this is the acetabular labrum. Okay, it's made up of articular cartilage, and this bit is called as the acetabular notch. Okay, so the importance of this bit is there is presence of one ligament. Okay, ligamentum teres. So to this point you have a small ligament that is originating here, and it is attached to the fovea of the head of the femur. Okay, I will show you when I am teaching about the joint. Okay, because this joint structure you have to know. So just know that this bone is the ischium bone, this is the pubis bone, and this is the ilium bone. Okay, now these three bones unite together to form the acetabular cavity. Okay, that's the socket of the hip joint. And now I am going to explain the various parts of this ilium bone. Okay, so this pit in the anterior aspect of the ilium, this pit in the anterior aspect of the ilium is called as the iliac fossa, whereas if you see turn laterally, this pit in the posterior aspect of the ilium is called as the gluteal fossa. Okay, it's called it as the gluteal fossa. It's called as a gluteal fossa. So this line are the gluteal lines. These are the gluteal lines where the gluteus medius and gluteus minimus are originating in this point. If you look at the origin, okay, you see this is the origin point of the gluteus medius, and this is the origin point of the gluteus minimus. Okay, and this is the origin point of iliacus muscle. So in the muscles I would have explained about the iliopsoas muscle, how the fibers unite and comes and inserts to the lesser trochanter of the femur. Okay, that we will discuss that separately in myology. Okay, so just focus. This pit is called as iliac fossa, and this pit is called as the gluteal fossa. Okay, and now this area is the articulating surface of the ilium, where the sacrum is articulating with this area. Okay, the sacroiliac joint is said to be the strongest joint in the body. The sacroiliac joint is said to be the strongest joint in the body, and it is somewhat special. It is partly synovial and partly cartilaginous joint. Okay, if you keep the sacrum here, you will know. So let's not discuss about the joint now. So let's go focus on the bones alone. And this prominence which you can feel on your hip is called as the iliac crest. This prominent area which you can feel in the pelvis is the iliac crest. Okay, so at the tip of this area, this prominence is called as anterior superior iliac spine, and this prominence is called as anterior inferior iliac spine. Likewise, this prominence is called as a posterior superior iliac spine, and this prominence is called as a posterior inferior iliac spine. Okay, note down: anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. I can show you. See, this is a posterior superior iliac spine and the posterior inferior iliac spine. So, and this in the ilium bone, there is a great notch. We call it as the greater sciatic notch. This curve is called as a greater sciatic notch, through which the sciatic nerve is passing. This is a greater sciatic notch, and this is the lesser sciatic notch. This is the lesser sciatic notch. So these are all various parts of the ilium. So let me review again. This is the articulating surface of the sacroiliac joint, iliac crest, anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, gluteal surface, gluteal fossa, and this is the iliac fossa. And in the right side, this is a place, this is the right iliac fossa. Okay, so this is a place where there is location of this appendix. Okay, in clinical exam you need to search for the appendix. In clinical exam you need to search for the appendix. Okay, you see, this is the appendix. Okay, and when you divide the body, this is located in the right iliac fossa. The appendix is located in the right iliac fossa. We will discuss that extensively in digestive system. Okay, this small finger-like structure is the appendix. Okay, now let's go to the next bone, the ischium. Okay, this ischium is the bone which you are landing when sitting during sitting posture. For example, whenever you sit on this prominence, that is the ischial tuberosity. This prominence is called as the ischial tuberosity. Okay, and this is the place where the hamstring muscle comes and inserts. Okay, so this part of the bone is called as the ischium. Okay, and in the ischium there is a spine-like projection. This is called as ischial spine, that is giving attachment for the pelvic floor muscles. This is the ischial spine. Okay, and this is the ischial tuberosity, and the extension from the ischial tuberosity is called as the ischial ramus. It's called as ischial ramus. Okay, these are, and moreover the lesser sciatic notch is formed below this ischial spine. The lesser sciatic notch is formed below the ischial spine. So moreover, if you see, there is the largest foramen. Foramen means hole in the bone, isn't it? So the largest foramen in the body is this obturator foramen. Okay, this obturator foramen is formed by this ischial bone as well as the pubis bone. Okay, so if you look at the parts of the pubis, this is the os pubis joint. There is another pubis here, and this joint is os pubis joint. And here you can see a small prominence. This is called as a pubic tubercle. This is called as pubic tubercle, and this extension is called as the superior pubic ramus, and this extension is called as the inferior pubic ramus. So now the superior pubic ramus of the pubis, the inferior pubic ramus of the pubis, and the pubic ramus of the ischium is forming this largest foramen in the body, that is the obturator foramen. That is called as the obturator foramen. Okay, so now if you see, whenever you stand, this junction, that is L5 S1 vertebra, this junction is the center of gravity of the human body. Okay, the whole weight of the body comes to this point. Okay, this junction is called as the center of gravity of the human body. So whenever you stand, your upper body weight comes like this, and then the weight gets transferred in this direction. Likewise, in the left side, the body weight comes like this, and the weights get transferred in this direction. Okay, that is, it is coming through the sacroiliac joint, the body weight coming through the sacroiliac joint. So in the ilium, this iliopectineal line, this line is the iliopectineal line. Through this line, the body weight comes to this head of this femur. From the head of this femur, it is going to the neck of the femur, and from the neck of femur, it is going to the trochanteric region, intertrochanteric region, and then it is going to the. So why I am drawing this line? Because I would have explained something called trabecular system in the part 1 of my lecture. Okay, what is a trabecular system? That is arrangement of osteophyte cells in the weight bearing line. Okay, so what you do, if you cut this bone here and see, these bone cells are highly compacted in the weight bearing line. These bone cells are highly compacted in the weight bearing line. Likewise, this is a common site for osteoporosis. Okay, and moreover, the osteoporosis is due to loss of calcium. The bone gets porous, isn't it? So when the patients get osteoporosis in this region, since the weight bearing line is present here, this is a easy site for fracture. Okay, so suppose if a patient falls with the outstretched leg, Okay, when the leg is stretched and the patient slips and fall down, there are chances for pubic ramus fracture, and the management is bed rest. Okay, if there is fracture of the ramus or inferior ramus or superior ramus, the management is bed rest, no need of any intervention. But if there is fracture in this area, then you need to do some intervention, because this is a weight bearing line. Through this line only the weight is transferred from the upper limb to the lower limb. So you have to understand the trabecular pattern in this weight bearing line, okay. So coming to the pubis, this is the superior pubic ramus, and this is the inferior pubic ramus. And moreover, this joint is os pubis joint. If you see, there is a disc in between these two cartilage. This is a cartilaginous disc. This is the fibrocartilaginous disc between the two pubis bone, and this joint separates during the time of pregnancy. Okay, that's why it's called as os pubis. Os means opening. So this is the os pubis joint. Okay, and it acts as shock absorber between these two bones. All right. So these are some of the parts, and moreover, to this pubic tubercle and to the anterior superior iliac spine, there is a ligament. This is called as a inguinal ligament. Okay, also called as a Poupart's ligament. This ligament is formed by the invagination of the anterior abdominal wall muscles. And this canal is very important, through which the femoral structures, femoral artery, vein and nerve is passing. Okay, so that we will see separately whenever I teach about this blood vessels or nerves. Okay, now what I have explained is this right innominate bone, and this is the left innominate bone. So the right innominate bone, left innominate bone, and the sacrum is forming the pelvic cavity. Okay, and now let's go to the thigh bone. That's the femur. Okay, the femur is said to be one of the longest bone in the body. Okay, the femur is said to be one of the longest bone in the body, the thigh bone. Okay, so I will remove the other bones. Okay, now what you see is this femur. Okay, so this femur is, as I told you, any long bone has upper end, lower end and the shaft. Okay, so this area is the upper end of the femur, and this area is the lower end of the femur. Okay, so in the upper end you have the head of the femur, neck of the femur, and then this trochanteric region, and then this trochanteric region. Okay, so I will show you one by one. So this part is called as the head of the femur. If you see the head of the femur, there is one fovea. Fovea means pit. Okay, to this fovea and to the acetabular notch there is a small ligament that is attached. Okay, this ligament is holding preventing the dislocation of the hip joint. So to show that ligament, I have to, okay, what you see here is, this is the ligament of the head of the femur, also called as ligamentum capitis. So this point is attached to the fovea of the head of the femur, and this point is attached to the acetabular notch. Okay, so this is what you have to understand here. Okay, so what you are seeing here is the head of the femur. Okay, and this is the acetabulum. This part is the acetabulum. So this part is called as the fovea of the head of the femur, and this area is the acetabular notch. If you see here, this ligamentum capitis that is attached between the fovea of the femur and also to the acetabulum or acetabular notch of the acetabulum is holding the head of the femur. Okay, some study says that the anterior 2/3 of the head of the femur, this area is receiving the blood supply through a small blood vessel that is passing through this ligament. Okay, that is passing through this ligament. So, and that thereby encroachment of this ligament leads to avascular necrosis of the tip of the head of the femur. Okay, so what happened, this is how the apart from this there are a lot of ligamentous joint capsule, and there are three strong there is a strongest ligament, iliofemoral ligament, that is attached between the femur. That I will teach in the joint. Just focus in the osteology part alone. So this is the head of the femur. Okay, and this is the head of the femur, and this is the neck of the femur. You know, the neck of the femur is prone for fractures. The neck of the femur is prone for fractures, and also the trochanteric line fracture is common in old age due to osteoporosis. The trochanteric line fracture is common in old age due to osteoporosis. Okay, so now what I will do is we will go to the neck of the femur. Okay, so now I'm going to hold this femur in the anatomical position. I'm going to hold this femur in the anatomical position. Okay, so this is the anatomical position of the femur. This is the anatomical position of the femur. This is the anterior view. This is the anterior view. This is the anterior view, and this is the lateral view, and this is the posterior view. Okay, posterior view, lateral view, and anterior view. So if you look at this prominence is called as the greater trochanter. So this area is more superficial. Only the skin is present on the greater trochanter. Only the skin is present in the greater trochanter. Okay, if I cut the skin, only the greater trochanter is there is no muscles on the greater trochanter. So what happens when the patient is lying in the side lying position, this area becomes the pressure point, and it is common area for the pressure sore. Okay, decubitus ulcer. So this is the important thing you need to understand in the greater trochanter. Okay, so you can touch the hand in the hip, and you can move your hip so that you can feel the prominence of the greater trochanter. Likewise, if you look at the posterior aspect, this prominence is continuing like here, and this prominence is called as a lesser trochanter. Okay, so a line between this in two trochanter, this is a greater trochanter, this is a lesser trochanter. This line is called as intertrochanteric line. This line is called as intertrochanteric line. Whereas if you look in the anterior side, this line is called as intertrochanteric crest. Okay, this line is called as the intertrochanteric crest. Okay, this is clinically very important because this line is a common site for fracture due to osteoporosis. Okay, this line is common site for fracture in the osteoporosis, and even the neck of the femur is also highly prone for fracture of the hip. Okay, so coming to the shaft of the femur. Okay, if you look at the anterior view or you look at the lateral view, this femur is concave. Okay, it is bent anteriorly. Okay, that is the shaft of the femur is bent anteriorly. It is concave shaped bone. Okay, it is a little concave, and moreover the anterior surface is very smooth, and it is giving place for muscle attachment. It is giving place for the anterior thigh muscle attachment. This is the attachment for the vastus intermedius. This is the attachment for the vastus medius, and this is attachment articularis genu muscle. Okay, and this is a place for attachment of vastus lateralis. Okay, the rectus femoris muscle is present on these muscles. Okay, so coming to the posterior aspect of the femur, there is a line, rough line. This line is called as a linea aspera. And gives a place for attachment of medial thigh muscles and the hamstring muscles. Okay, this line is called as the linea aspera. It's a rough line. Okay, so this linea aspera is dividing into right side and the left side. So this line is called as the medial supracondylar ridge, and this is the lateral supracondylar ridge. This line is the lateral supracondylar ridge. Okay, so now let me put back the bone in anatomical position. Okay, now what you see here is the medial condyle. This prominence is called as the lateral condyle. This is the lateral condyle, and this is the medial condyle. This area, this prominence of the femur. Let me remove the other bones. So that it will be clearly visible for you. Okay, so this is the medial condyle and this is the lateral condyle, and the pit between these two bones is called as intercondylar notch. Okay, this pit is called as the intercondylar notch. So the inferior surface of the condyle is covered by a hyaline articular cartilage, which is taking a part in articulation in the knee joint. Okay, this is the articulating surface of the condyles of the femur. It is the articulating surface of the condyles of the femur. Okay, so now in lateral aspect of the femur, you can see there is a prominence. This prominence is called as a adductor tubercle. Okay, so these are various parts of the femur, and femur fracture is very common in old age. Okay, femur fracture is very common in old age. And now let's go to the next bone, the patella. Okay, this patella, this is a patella, is called as a kneecap. This patella is called as the kneecap. Okay, this is anterior view and this is a posterior view. You see, anterior view is rough, whereas posterior view is covered by a articular cartilage. It is covered by the hyaline articular cartilage. And you know, this patella is said to be the largest sesamoid bone. The patella is said to be the largest sesamoid bone in the body. Okay, so if you see how this patella is present, this patella is engulfed by this quadriceps muscle tendon. In the anterior aspect of the thigh, you have the quadriceps muscle. Okay, that is the four muscles: rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. These muscles come and swallow the patella and then take the name as a patellar tendon. So this is a patellar tendon, also called as ligamentum patelli. This ligament is called as a ligamentum patelli. You see, this is the patella bone. This is a patella bone. This is a patella bone. The quadriceps muscle is swallowing the patella and it is coming and inserting in the tibial tubercle. So this patella is enclosed in the tendon of the quadriceps muscle. That is why it is called as a largest sesamoid bone. That is why it is called as largest sesamoid bone. You see, this patella is just present before the femur during the time of extension. So this patella is acting as a lever, as a fulcrum. Okay, during the time of extension, this patella is acting as a fulcrum, and if there is any fracture of the patella, well, in some case they remove the patella. Patelectomy is done. Sometimes they try to suture the patella with iron wire, metal wire. There is no adverse effect, but still patella is important to have a powerful extension of the knee, because the patella is acting as a fulcrum on the knee joint. The patella is acting as a fulcrum in the knee joint during the time of extension. Okay, let's go to the next bone, the tibia, which is one of the strongest bone. Because why the tibia is strongest? Because the full body weight is coming to the tibia only. Okay, now the tibia has the upper end, lower end, and the shaft. The tibia has the upper end, lower end, and the shaft. Okay, so if you see, this part is the medial condyle of the tibia, and this part is the lateral condyle of the tibia. Okay, this is the lateral condyle and this is the medial condyle, and you see this prominence is called as tibial tubercle, to which the quadriceps muscle tendon comes and inserts here. Okay, if you see here, in the lateral aspect there is a fibular articulating facet. Okay, the fibula bone is articulating in this area, that's called as a fibular articulating facet. So the fibula is not a part of knee joint, only the tibia is taking part in the knee joint. Okay, so you have to know that the fibula is nowhere a weight bearing bone, it is just present only to give a support. Okay, and to give muscle origin and insertion, muscle attachments. Okay, so if you look at the tibia, this is a medial tibial condyle and lateral tibial condyle, and if you look at the superior aspect of the tibia, this area is flat. Okay, this area is flat, that is why this area is called as the medial tibial plateau, and this is a lateral tibial plateau. So in between these two, this place is prominent, and that area is called as intercondylar tubercle. Okay, intercondylar tubercle. So this tubercle gives attachment for the knee joint. Okay, you see here. Okay, this is the menisci, the disc that is present in the knee joint, and this tubercle, intercondylar tubercle, gives attachment for this. It gives attachment for this cruciate ligament. This is anterior cruciate ligament, and the posterior cruciate, this is a posterior cruciate ligament. So in joint, when I am teaching, I will explain about that. Okay, don't worry, because this joint is something you have to read very carefully. You have to understand all the connective tissues, ligaments in the joint. So for time being, know that the intercondylar tubercle gives attachment for these cruciate ligaments in the knee joint. Okay, on the tibial plateau there is two fibrocartilaginous discs, that is called as the menisci, the lateral and the medial menisci. On this menisci only the femur is sitting. The femur is sitting on this menisci like this. Okay, the femur is sitting on the menisci like this. Okay, the femur is sitting on the menisci in this manner. Okay, so now let's go to the other parts of the tibia. Let's go to the other parts of the tibia. So as I told you, okay, so this is the fibula, this is the fibula, this is the fibula, and this is the tibia. You see, fibula is not at all taking part in the knee joint. Okay, so fibula is not a part of knee joint bone, and it does not take part in weight bearing activity. So coming to the shaft of the tibia, as I told you, this tibial tubercle is present in this region, which gives attachment for the quadriceps muscle. Okay, and this prominence in the anterior aspect of the tibia, this prominence in the anterior aspect of tibia shaft is called as a tibial shin. Is called as tibial shin. The problem with this is, there are no muscles on the tibial shin. You see, this tibial only the skin is present. You see, I kept all the muscles on the leg, okay, in the medial aspect of medial shaft of the tibia, and on this tibial shin only the skin is present. So whenever there is any hit or trauma, there is severe amount of pain on the tibia because muscles are not present. Under the skin directly bone is exposed, okay, and this is the reason where the infection can easily enter through the skin to the tibial shin, and moreover the tibial shin is more sensitive also. All the periosteum is, in fact, it is sensitive, okay. So now coming to the this lateral border, this is the lateral border of the shaft of the tibia, and as I told you, and this okay, there is a membrane between this tibia and the fibula. This is called as the interosseous membrane, okay. This is a membrane that is present between the tibia and the fibula. This is called as the interosseous membrane, and this border is the interosseous border. This border is the interosseous border, okay. So coming to lower end of the tibia, the lower end of the tibia and the lower end of the fibula forms the ankle joint. Well, this prominence in the medial aspect of the ankle joint is called as medial malleolus, and this prominence in the lateral aspect of the ankle joint is called as lateral malleolus, okay. This is a medial malleolus and this is a lateral malleolus. Both this malleolus gives attachment for the collateral ligaments, okay. So if you look at the inferior aspect of the tibia, this is some sort of quadrangular articulating surface that is sitting on the head of the talus. Quadrangular surface that is sitting on the head of the talus, okay. So coming in this place, this notch here is called as a fibular notch, where the tail end of the fibula is coming and sitting, okay. So when these are various parts of the tibia, and tibia is said to be the strongest bone. And coming to the fibula, this part is the head of the fibula, this part is the head of the fibula, and this is the neck of the fibula, and this is the shaft of the fibula. This is the shaft of the fibula, and this prominence is called as a lateral malleolus. This prominence is called as a lateral malleolus. So this lateral malleolus is palpable and prominent for all the persons, okay. So if you see here, if you see in this place, the neck of the fibula is clinically important, because on the neck of the fibula, the fibular nerve, that is the lateral popliteal nerve, is coiling the neck of the fibula, okay. Here this, okay. This is more superficial, and direct hit to this region, this area is the neck of the fibula, direct hit to the region can damage this nerve root, and it can lead to foot drop, because this is a nerve that is supplying the muscles of the anterior leg, that is the dorsiflexor muscles. This is the nerve that is supplying the dorsiflexor muscles, okay. So, and it is more superficial in the neck of the fibula, okay. So now coming to the tarsal bones, there are 7 tarsal bones as such. So I would like to remove these bones. I'll remove this fibula, and these are the tarsal bones and the metatarsal bones. Okay, so these bones forms the foot. These bones forms the foot. So coming to this is the first tarsal bone, that's a talus bone. Okay, this is a talus bone, and this is anterior view, lateral view, and the posterior view. Okay, if you look at the anterior superior aspect, the tibia is coming and landing on the talus. Okay, and this is the lateral view, and it is articulating with other tarsal bones, and posteriorly it is articulating with the calcaneum, and anteriorly it is articulating with the navicular bone. So I will show you. Okay, so this is the navicular bone and this is a calcaneum bone. So what happens when tibia is bringing the body weight? When the tibia is bringing the body weight here, the weight is transferred to the navicular and to the calcaneum. In fact, this is the spot where you come and land. This is the spot where you come and land. Okay, so this is the neck of this is the talus bone. I will remove that. The next bone is the calcaneum. Okay, the calcaneum is the largest of all tarsal bones. The calcaneum is the largest of all tarsal bones, and this calcaneum is transferring. It's called as a heel bone. This calcaneum is called as a heel bone, and this place it gives attachment for the spring ligament. Okay, the aponeurosis of the foot. Okay, and this is the heel area which gives attachment for the Achilles tendon, Okay, you see, this is the Achilles tendon, the strongest ligament, strongest tendon in the human body. Okay, the calf muscle tendon. So what happens when this muscle contracts, you are able to walk. Okay, so okay, now I will remove the calcaneum. This calcaneum is articulating anteriorly. This calcaneum is articulating anteriorly. Okay, this calcaneum is articulating anteriorly to this cuboid bone. Okay, the calcaneum is articulating to the cuboid bone. So I will remove the calcaneum now. Okay, now the remaining bone is this cuboid bone. Okay, this cuboid bone is present in the lateral aspect, and this is a navicular bone. This is also a boat shaped bone. You can see this is the shape of the navicular, like a boat. Okay, so this navicular bone is transferring the weight. It is articulating with this cuneiform. This is a medial cuneiform, intermediate cuneiform, and lateral cuneiform, and this is a cuboid. So this is the we can call it as a subtalar joint. These are all the subtalar joints. Okay, this is the metatarsal. So this is a metatarsal bone. This is a tarsal bone. So this line is called as the tarso-metatarsal joint. Tarso-metatarsal joint. These are the subtalar joints. Okay, so I will remove the navicular, and in the last row you have this cuboid that is present in the lateral aspect, that is articulating with the third and fourth metatarsal, and these are the three cuneiforms, that is the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. So there are 7 tarsal bones: the tarsal, the calcaneum, the talus, calcaneum, navicular, cuboid, medial cuneiform, intermediate cuneiform, and the lateral cuneiform bones. Okay, the cuneiform bones and the cuboid bones are articulating with the metatarsal bones. or articulating with the metatarsal bones. So if you look at the metatarsal bones, there are 5 metatarsals. This is the first, second, third, fourth, fifth. So same like this, the metatarsal, there is a head of the metatarsal. This is the head of the metatarsal, and this is the base of the metatarsal, and this is the shaft of the metatarsal. Okay, so like in the finger there are 2 phalanges. This is the proximal phalanx and distal phalanx in the great toe. We can also call it as hallux. Okay, whereas in the remaining toes there are 3 phalanges. This is the proximal phalanx, intermediate phalanx, and distal phalanx. Proximal, intermediate, distal, proximal, intermediate, distal, proximal, intermediate, distal. Okay, the speciality is all these bones are arranged in the foot to form the arch of the foot. Okay, to form the arch of the foot, So what I will do, I will show you the base of the foot now. I will show you the base of the foot so that you will be able to understand. Okay, this is the inferior aspect of the foot. Okay, so you can see, if you look at this skin here, this is the medial arch. If you look at the skin in this place, this is the medial arch of the foot. Okay, and this is how the foot is present. Okay, this arch is very important in order to transfer the body weight to the ground. Okay, so this arch should not be collapsed. So what happens here, when this arch is maintained by all these connective tissues, you can see this is the plantar aponeurosis. You can also call it as a spring ligament, and these are all the foot muscles. Okay, so these foot muscles helps to maintain the arch. Maintain the arches of the foot. So muscles we will discuss separately. So now we will go for plantar aponeurosis. So if you look at this, you see the texture of this ligament helps to maintain this arch of the foot. So what happens when there is muscle paralysis or when there is weakening of this ligament, then the foot arch collapses and the foot becomes flat foot. So when the foot becomes flat, what happens, the body weight doesn't get transferred at the equal ratio. Okay, so this is collapse. This will be collapsed, and it leads to continuous pain. Okay, as the person grows, it will lead to continuous pain as the person is growing. Okay, so this is what you have to understand about the arrangement of the tarsal bones in the foot. Okay, so by this we are completing this bones of the lower limb.